young individuals who want to be an orthopedic surgeon, they have multiple doubts in their mind whether they want to be an orthopedic surgeon or not. What are the pros and cons of orthopedic surgeons? And is this branch really saturated? So I'll be talking about each and everything in this video. So keep watching the video.
Feel me like a Hellcat.
So I started my career in 2016 when I got admission in MS Orthopaedics. I did my MS from DY Patil, Navi Mumbai. Since then I have been practicing Ortho. Ortho is a branch which is vast and it has multiple subspecialties. But the basic is your trauma. So if you are thinking to take Ortho as a branch, just be ready to treat trauma first. By trauma I mean fractures. So trauma will be the bread and butter of your orthopedics. So the first query which multiple people have is this branch really saturated? I'll answer this. No, this branch is not saturated at all. Trust me on this thing. You have multiple cases till date. It doesn't matter whether you are working in a tertiary center or you are working in any metropolitan city. It doesn't matter. This branch is not saturated till date. So you don't have to worry about anything. See, if you are intelligent enough and you know where you are needed, you are the boss in this orthopedics. So don't even worry about it, and it's not saturated at all. So the next query which comes is, who should take this branch? I'll answer this as well. People who are sports lover should go for it. They should not even think twice, but they should directly go for it. What you need to have is your skills, your brain, plus you should be tech oriented. You just don't need your power. So girls, this branch is very much for you also. If you are a sports lover, you have skills oriented. So now coming on the positives and the negatives of being an orthopedic surgeon. Firstly, I'll talk about the positive points. So the first one is the age at which you become an orthopedic surgeon. It's like really very young. If you want to be a cardiac surgeon, if you want to be a neuro, if you want to be any other specialist, you need to invest your 6 years after your MBBS. But if you are directly going for orthopedics, you just need 3 years and you are a young buddy who can be an orthopedic surgeon. So age at which you start practicing is still very young in comparison to your other people. Second thing which comes is the risk of life. So the risk of life is less in comparison to the other branches like neuro, respiratory, cardio. The risk of life here in ortho is less. I love this branch because I feel it gives me job satisfaction. So this is again a positive thing. Fourth thing which comes is the money earned. Eventually, by the end of the day, everybody wants to see how much money they have earned being a doctor. So as an individual, you'll earn a lot if you have your skills, your brain, and if you are tech oriented. Other positive point about this branch is you have multiple subspecialties. If you are looking for arthroplasty, if you are looking for orthoscopy, if you are looking for pediatric ortho, spine. So there are multiple subspecialties in this branch, which is a good thing. If you want to be a specialist in some particular branch, you can just go for it. I guess other branches have these options, but they are limited. But in ortho, we have multiple subspecialties. So these are few points which I feel being an orthopedic surgeon makes me happy. But obviously there are few negatives also. I'll be talking about that also in this video. The first one is the occupational hazard. The radiations which we go through in the operating room, it's a lot in comparison to other branches. MD medicine, they don't have to face all this. Be it any other branch, they don't have to face radiations as we people have to face the radiations of the C-arms. So this is the negative which I feel. Second thing which comes is the margin of error. We people have to get our x-rays done post-surgery. So the margins of error are very less because whatever you are doing, it's visible on the x-ray. So the margins of error are obviously very less because anybody can make out. Third thing which comes is you have to be on your toes every time. You have to be on emergency calls. You have to work for 24/7. This can be a drawback for anyone who have been staying away from the hospital. So you have to be on calls 24/7. The last thing which I feel are the cons of being an orthopedic surgeon is the number of complications are a lot. The complications related to the neurovascular structures or infection, they are a lot. So this is a negative which I feel Being an orthopedic surgeon, you have to deal with this. Non-union, malunion, blood loss. These are few complications which we feel we have to face it in multiple cases. So you have to deal with it. So I have spoken about the positives and negatives as well in this video. I hope now you guys will be clear in your head whether you want to be an orthopedic surgeon or not. And if you want to be an orthopedic surgeon, just go for it. Don't even think twice. Thanks for watching this video. Keep liking the videos, keep sharing it. Thanks for your love and support once again.